All right, today we're going to decode something pretty important, the endometrium. Now that's the dynamic lining of the uterus. And the key to understanding it is a procedure a lot of people have been through but maybe don't fully get, the gynecological ultrasound. We're going to pull back the curtain and show you exactly how to read the story that's right there on the screen.
You've probably wondered this yourself, right? You're lying there, you're looking at the screen with all these black and white shapes, and the sonographer is quietly taking notes and measurements. What are they actually looking for? What kind of story is that image telling them?
And you know, it really is a story, one that's told in monthly chapters. See, the endometrium isn't just static tissue. It's in constant flux, building up and then breaking down. These images here show just how dramatic that transformation is. And understanding that rhythm, that cycle, is the absolute key to decoding the ultrasound.
So, to read that story, we've got to start with the most basic question. Why are we so focused on the endometrium in the first place? What makes this one specific part of the body so important to look at?
Think of the endometrium as this super responsive, dynamic inner lining. Its whole job is to get the uterus ready for a potential pregnancy every single month. And if that doesn't happen, well, it sheds during menstruation. An ultrasound lets doctors get a direct look at how well it's performing that cyclical job.
Now, a scan can be done for a lot of reasons, but the number one reason by far is to figure out what's causing abnormal uterine bleeding. It's the first critical step to see if the cause is a structural issue like a polyp or a fibroid, or if the answer is buried somewhere in the body's hormonal signals.
Okay, so we've got the why down. Now let's jump into the how. Honestly, just knowing what to expect during the procedure itself can make a world of difference.
The whole process is actually very straightforward. It always starts with a chat about your medical history, like the date of your last period, because that gives them crucial context. The scan itself is done by a trained professional in a safe, reassuring space, and they should be talking you through it the whole time. Communication is everything.
Now, you might not know this, but there are actually two main ways to do the scan. The first is transabdominal. That's on the outside of your belly, and it gives a great general overview. But for the clearest, most detailed look at the endometrium, the transvaginal scan is really the gold standard. It uses a much narrower probe that gets closer to the action, giving a way sharper picture.
All right, this is the fun part. This is where we get to put on our detective hats. Once that image is up on the screen, what are the specific visual clues that doctors are trained to hunt for?
The first, and maybe most fundamental clue they look for, is thickness. It sounds simple, right? Just a measurement, but it tells them so much about where the endometrium is in its monthly cycle, or if something might be off. So they take this measurement in millimeters, right at the thickest part of the lining, and that single number is incredibly informative. Because while the thickness is supposed to change all month long, a measurement that doesn't quite match the timing can be the very first sign that something needs a closer look.
The second clue is all about the shape of the lining itself, its texture, its contour. A healthy normal endometrium usually has a pretty smooth, predictable surface. So doctors are looking to see if that surface is uniform, or if there are any bumps or irregularities that could point to a growth or some other issue.
And you can really see the difference here, can't you? The images on the left show a lining with a nice, smooth, regular outline. That's the typical appearance we'd expect to see. Now compare that to the image on the right, where the outline is all irregular, almost spiky. That different texture is another vital clue that helps build the whole diagnostic picture. Okay, our final clue is something you can't even see in a standard black and white ultrasound image. To see this, doctors use a special setting called color Doppler, which lets them actually visualize blood flow. And this just adds a whole other layer of information. As you can see in these diagrams, doctors are on the lookout for specific blood flow patterns. Is there a single dominant blood vessel that's feeding a specific area, which might suggest something like a polyp? Or is the blood flow more scattered? Each pattern tells a completely different story. So we have our three major clues: thickness, shape, and blood flow. How do doctors put all those pieces together to get from an image on a screen to an actual confident diagnosis? For postmenopausal women who are experiencing bleeding, it often comes down to this one single number: 4 millimeters. This table shows you exactly why that number is such a game changer. Basically, if a postmenopausal woman has bleeding, but her endometrium measures less than 4 millimeters thick, international guidelines show with over 99% confidence that cancer is not the cause.
It's an incredibly powerful way to provide reassurance and avoid a lot of unnecessary invasive follow-up procedures.
But, and this is a really big but, for women who haven't gone through menopause yet, there isn't one single magic number. The key here is context. A thickness of, say, 12 millimeters might be perfectly normal late in the cycle, but it would be pretty unusual right after a period. It's all about matching the ultrasound clues to the correct chapter of the story.
Okay, so let's zoom all the way out to the big picture. These rules and clues we've been talking about, they aren't arbitrary. They're actually the result of a massive, coordinated, global effort to standardize exactly how these scans are done and how they're read.
The source material for this whole explainer is a consensus statement from something called IUSUOG, the International Society of Ultrasound in Obstetrics and Gynecology. And their entire mission is to make sure every doctor, everywhere on the planet, is performing and interpreting these scans using the best, most up-to-date evidence possible.
And that's why this all matters so much. When every doctor is speaking the same clinical language, describing thickness, shape, and blood flow in the exact same way, it leads to more accurate, more reliable, and just plain less confusing diagnoses for every single patient. It takes a lot of the guesswork out of it.
It's a really powerful idea when you think about it. Creating a clearer picture leads to a clearer path forward. And it kind of makes you wonder, what other complex medical questions could we answer more simply if we could just all agree on a standardized way to look for the clues?